welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with Baycare's Winter Haven Hospital to provide you, the community, an opportunity to learn more about our local physicians, as well as the important programs and services Winter Haven Hospital provides to keep our community healthy and thriving. On today's episode, we have the privilege to speak to Dr. Hassan Ebrahim. Dr. Ebrahim is board certified in internal medicine, medical oncology, and hematology. Today, we focus on skin cancer and the ways to mitigate your risk, as well as to learn the signs and symptoms of skin cancer. Well, Dr. Ebrahim, thank you so much for joining us today for our Ask the Doctor series.
Thank you very much for having me here. It's my pleasure.
So one thing I like to start these interviews with is to give the general public an opportunity to learn a little bit more about you as a person and kind of what your journey was to Winter Haven. So tell us a little bit more about you.
So I am a medical oncologist, board certified. I practice in the field of cancer medicine. Originally from Virginia, did my training in Washington, D.C., worked with in North Carolina at East Carolina University in the faculty, then moved to Florida about 6 years ago. I like the Central Florida area, and I've been practicing here. I've joined the Baycare Medical Group in Winter Haven Hospital, and we have been involving in a lot of community outreach for cancer screening, etc. So this is a good opportunity for me to be here and deliver some important information.
Absolutely. Well, and of course, we're entering into summer, and this is the time where it's hot, right? So everybody tries to wear as little as possible as we are going out and enjoying the beach or the chain of lakes, all of those sorts of things that makes living in Winter Haven in Central Florida so wonderful, but it also puts us at a little bit higher risk for skin cancer and some of the other side effects of that. So talk a little bit about who is most at risk for skin cancer.
Yeah, that's important actually. You know, people come to Florida, I mean, including me, come to Florida to enjoy the sun, to enjoy the beaches and all that, which is excellent. And it does actually benefit people that have vitamin D, etc. But of course, it has some also concern about developing skin lesions, skin cancers. I mean, the people that high risk of having skin cancer is generally lighter skin population, Caucasian or light skin. Patients who have been exposed to previously to burns, or they have freckles, or they have blue or green eyes are slightly at higher risk. Those who have higher numbers of moles can turn into cancer, and family history, and of course excess sun exposure in generally. But those are the populations that I mentioned, in addition to if somebody has personal history of skin cancer. Usually those are the ones that they can come back, and older population above the age of 60 are usually more common.
What is UV radiation? We see a lot of products that talk about, protection up to 50 plus and all of that, but talk a little bit about what UV radiation is.
So what's interesting is sun is a source of UV radiation, and there's others. So the sun, of course, is one of them, is the most important. That's why we have to be, again, sun is very important in converting vitamin D in active form to become active, and that's important for our bone health. But it carries the risk of having also excess exposure, carries the risk of having skin cancer. So sun is one, and also there's artificial sources. Tanning beds, especially indoor tanning beds, are one of them. Some type of lights called mercury vapor lighting, and those are used in stadiums and school gyms, are having UV radiation. Some type of lasers can have UV radiation, and also there is some halogen and fluorescent lights can have some UV radiation. So, but the main two are the sun and indoor tanning.
You know, you naming all of those artificial sources, I feel like that makes it even more important to be putting on your sunscreen every day. You know, you talk about, especially a lot of feminine lotions and products, skincare products have SPF protection built into them now. But even from the male population that might not be putting on those skincare products every morning, right, and those lotions, reiterates that even if you don't think you're going to be out in the sun that day, it's still important to put that on, I would assume.
Sure.
So what is melanoma? It's a common thing that we all hear about, but what is it?
So melanoma is, there is 3 types of skin cancer, main types of skin cancer. Squamous cancer, squamous cell cancer, basal cell cancer, and melanoma. Melanoma is by far the most serious type. Why? Because it is the one that can grow fast and spread fast, metastasize fast. If you look at cancer mortality, skin cancer mortality, by far melanoma makes the majority of it. Melanoma is start in the skin and can definitely go to the lymph nodes and can go to other areas of the body, including the brain, lung, liver, etc. So we take it very serious. If it's discovered in early stages, it's extremely curable. So anybody has a questionable or suspicious skin lesion, it has to be addressed immediately and appropriately.
So from the preventative side, what are the best ways that individuals protect themselves against skin cancer?
Like I said, sun exposure is important for vitamin D, but excess is dangerous. So the first thing I would start with is to be appropriate and reasonable in sun exposure. So try to stay out, especially in the middle of the day of the sun, from like 10, 11 o'clock in the morning until 4 p.m. Sunscreen is so important. Apply it as much or as often as it can be. And you can even repeat it in the same day if it's feel like it's, you know, especially those who are going to the beaches, those who are working in the sun or have any daily sun activity. Using the clothes, wide brimmed hat, long sleeve, shirts, sunglasses, long pants, and just cover the whole body. And avoid indoor tanning.
Yeah, and I feel like even just culturally, the wide brim hats are coming back. So they're even stylish now to make sure that we have those on outside. So what are the common signs and symptoms? Because I think all of us in Florida, I mean, we really grow up, even my toddler knows, got to put on sunscreen before we go outside. It just becomes a part of your routine. But what are those common signs and symptoms we should be looking for as Floridians when it comes to skin cancer?
Any new skin lesion that has signs and of suspicious or signs that could bring the attention. And I think a lot of people now know in the community what the ABCDE is. Can go through them. So any skin lesion that has the ABCDE, which stands for asymmetry, meaning something in the skin that doesn't look asymmetrical, you know, like it looks weird, especially if it has 2 sides and one side is different from the other. Border, B is border. I mean, the border is irregular. If it looks regular, that means more benign. C mean color, mean the color is variable. There's no, it's different colors, multiple shades, area gray, area white, you know, those are the things you need to be looking at. D is the diameter. If the lesion is greater than what we call 6 millimeters, so I would say the size of a bean or larger, that definitely is something that to be concerned with. And E called evolution, mean a change, whether a change in the size, change in the shape, change in the color. Those are the things that we look at. The individual has to be looking at, and once he or she sees any of those signs, he has to be very careful and probably seek medical advice immediately.
And how often should an individual be examining their body or their spouse, partner, children's body to look for signs of skin cancer?
The recommendation is to examine your body at least once, maybe every month or two. And skin self-exams, especially done, and maybe more frequent, those who have a higher risk, which we highlighted earlier, older population, those who have personal skin cancer history, family history, blue-eyed, green-eyed, those freckles, yeah.
I feel like you're talking directly to me on this with my blue eyes, my blonde hair, and my freckles right here.
You're gonna be okay, but just be careful and just put the sunscreen, stuff like that. So the recommendation is to do it like that. Have to be staying by a mirror, expose your body, have the mirror look at every angle, every side of your body. If you look at any new lesion, spot, lump, pump of the skin, you have to examine it thoroughly. If you have like a magnifier, something that looks like it's scaly or gonna bleed, have to carefully examine that. Warts, scaly lesions, and any lesion that has ABCD, like I mentioned earlier. So those are the things that we have to be very careful with.
And how often should people be seeing a professional for skincare screenings? Because I know obviously you do your best at home, but how often should we be seeing a physician, a dermatologist, or someone along those lines to take a look at our bodies for us, primary care physician, whatever that might be?
So, I mean, this is definitely very variable. This is very variable. I mean, every single person should have a primary care provider who is able to look at the skin. And if they find that the patient has suspicious skin lesions, then they refer them to dermatology, or if they want, sometimes they scrap the lesion and find out. Now, so again, it's very variable. Some people may require once a year. Those who have history of skin cancer will require every 3 to 6 months, especially melanoma, and they have to do a complete skin exam. So at least once a year, but it can be at shorter interval depending on the history and depending on the personal history of skin cancer.
Well, Dr. Ebrahim, thank you so much for sharing such valuable information to us. And it's important this time of year, obviously, because a lot of us are outside a lot more, but really in Florida, it's important all times of year. I mean, we thankfully live in a beautiful state where the weather is good for most of the year. And we're a growing state. I mean, more and more people from across the country are coming to enjoy our hidden secret for many, many years. And so it's so important that people pay close attention to their health, but especially their skin's health. Is there anything else that you want to make sure our listeners know and understand about skin cancer?
Actually, I want to highlight, because what you're saying makes it's very important, is somebody might hear what I say and just start to get worried. No, I mean, there's no worry at all. Those things are visible. Those things can be detected and early. They are very, very curable. They take them out. All what we need, just emphasize on taking the precautions, self-exam, immediately seek advice or help if you see something, and try to avoid, avoid the high-risk situations of, like I said, the indoor tanning, excess sun, and all those things. And most of the skin cancers, 99% of them are very curable. The doctors are taking them out. The earlier to find them, the better.
Very good. Well, thank you so much again for being on the call today. We really appreciate it.
Thank you very much for being here. Thank you.